Welcome to One-on-One. I'm Steve Adubato. More importantly, everything you ever needed or wanted to know about healthcare, you're going to find out. Erhardt Preitauer is Senior Vice President of Government Programs and CEO of Horizon NJ Health. Good to see you.
Good afternoon, Steve. Thanks for having me.
We were talking about a whole range of healthcare issues right before we kicked off on the air. A more holistic approach to delivering healthcare, what does that mean?
Really, it's about understanding the member, their family, and all of their needs. Not just their medical needs, but a lot of people have social needs, behavioral needs, physical needs, community needs. It's really understanding the member and their family, by the way, and being able to put together a plan that has that member served through all the different aspects of their needs. And really doing that well helps people live a better life. There's so many different examples where there's a member that I spoke with last week. He was homeless. Bunch of different chronic conditions.
This is someone who is, by the way, let's put it in perspective. How many members do you have?
We serve about 1 million members in government programs. These are Medicare or Medicaid eligible people.
Got it, go ahead.
So this member was homeless, and he had a bunch of chronic conditions, some lung issues, behavioral health issues. He wasn't getting any of the care, going to the emergency room every single day. When we got him a place to live, then we could start working with him on his medical issues. Nobody's worried about going to the doctor if they don't know where they're going to eat tomorrow. That's the kind of thing that we do.
It's interesting because when someone thinks about your company or any other health insurance company, you don't think of a company being involved in these kinds of things. It's like, do you cover this procedure or not?
Right.
That's not going to get it done anymore. Right. Just that way to look at healthcare, correct?
And I'll tell you, I'm so honored to be a part of Horizon. I mean, we focus on what the member needs. And our care coordinators, I mean, they're so passionate. We've got 175 of them out in the field. These are nurses and social workers.
What are they called?
Care coordinators, field-based care coordinators. They're out in the communities where our members are, in community centers, in their homes, under bridges, in nursing facilities.
What do they do?
They sit down and they really understand what this member needs. And they put together a plan for this member. And whether or not we cover it or not, these care coordinators bring together everything that member needs to be able to live a fulfilled, happy, healthy life where they're at.
It's interesting. Right before we got on the air, I asked you what the economics of all this are. So covering or caring for people in this way, I'm thinking, well, okay, it's got to be more expensive. And you said, no, it's actually saving money. Make that case.
There's two things. One is, if we can really understand what that member needs, a lot of times they're in the community. They're with their family. And a lot of times families, they don't know what to do. We'll bring home care. We'll bring additional help. We'll turn ramps into, chairs. We'll change stairs into ramps. I mean, we'll do a lot of different things.
That's a big deal.
Absolutely. Home modification, widen doors. We'll be able to do a lot of different things so that this person can stay at home. They're happier at home. Their families are happier. We can support them. We can bring adult daycare. We can bring somebody in the house to help them with chores.
But how's that cost savings?
On average, to keep somebody in the community versus having somebody go to a nursing facility, it's about half of the cost.
Is that the goal, to quote unquote keep that person in the community?
Really, the goal overall is to keep the person where they're most comfortable, where they're going to have the right peace of mind. A lot of times that is in the community, and that happens to be much cheaper than being in a nursing facility.
I'm wondering, it's so interesting as you lay this out, one, is likely to ask, okay, so we know this, it sounds logical on a lot of levels. Why do you think it took this long for leaders in the healthcare industry to say, hey, we need to re-examine the entire way we're doing this?
First, let me say, I think this program that the state of New Jersey, ultimately it starts with the state, right? This program that the state of New Jersey has set up, it's among the best in the country.
And the program is called?
Managed Long-Term Services and Supports, or MLTSS for short.
MLTSS.
Absolutely. So it's, in my opinion, and I've worked in a bunch of states with a lot of these different programs. So New Jersey, I think, for this program is very cutting edge, very forward thinking. But to answer your question directly, it's a very complicated program. A lot of technology goes into being able to go out into the field. The model, the way we go out, the field-based care coordinators, all of this is very, very different than the traditional delivery. So I think we're well on our way. We're well on our way in New Jersey. The country, I believe, is watching. And I think you'll see more and more states go towards this model over the next few years.
Before I let you out of here, you use the expression, it's complicated. For people who say things like, why can't they, and they always refer to they, they is always someone else other than the person talking. Why can't they fix the healthcare system? And you're arguing how complicated it is. Is it complicated just because of the nature of delivering healthcare to a very diverse set of people, a diverse population with all kinds of needs and different, paying is not easy either. And the fact that it's gone on for a long time the way it is healthcare, by the nature of what it is, complicated?
Well, let me tell you a quick story. So first of all, my 94-year-old grandmother wonders why I haven't fixed healthcare. Okay. So in that case, it's not they, it's me. Yeah. I was actually in somebody's house, and this lady was about 90 years old. English wasn't her first language. And I do ride-alongs with my care coordinators because I want to understand what's really going on.
Right?
Absolutely. So we asked this woman, the care coordinator, right, our nurse, well, she didn't get her drugs. And we asked her, why didn't you get your drugs? Doesn't speak English very well. She got her purse and she opened it and she poured out all these ID cards. Part D card, Medicare Advantage card, discount card, her food card, her all these different cards. I think there were 12 of them. And you're sitting there looking at that. Depending on what card you show, you may or may not get different services under an unstructured type of program. Well, part of what we do is we bring that together, but the story doesn't end. This lady then turns around, she pulls out this huge file folder. She had saved every benefit booklet, every member guide, every piece of paper that came with all these cards. It was this big. And you sit there and you realize, how is this person going to be able to navigate through all of that?
She can't.
She can't. I couldn't, right? So what our program is beginning to do, and we have more opportunity, is to bring all that together. One care coordinator.
Well, it's important stuff, and we'll continue to monitor it and try to teach people and help people, and you've done that today. I want to thank you for breaking it down. Appreciate it.
Thank you for having me.
Stay right there. One-on-one will continue right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by New Jersey Resources, the Northward Center, the New Jersey Education Association, Verizon Communications, Investors Bank, New Jersey Sharing Network, and by Choose New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
Hi, I'm Peter Rooney. In 2006, I lost my father to renal disease. He was on the waiting list for a new kidney, but did not receive one in time. Unfortunately, so many like my father have lost their lives while waiting for a life-saving organ. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and by informing people about this important decision. Because you can make a difference and save a life.